So you've applied to the job, you've passed the initial screening, and now you've got a Microsoft Teams link sitting in your calendar for the first official NHS physiotherapy interviews. And this is the moment where most people panic. But stop. Here's the truth. The NHS isn't interviewing you to see if you are a walking anatomy textbook. They assume you know the muscles. They are interviewing you to answer one question. Are you safe? Hey friends, welcome back to the channel. If you're new here, my name's Ibrahim and I've helped over 1,000 people with their applications. We're going to split this video up into three parts. First, I'm going to talk about the safety first mindset, and then we're going to do a deep dive into the two golden frameworks to structure your answers. And finally, we're going to run through three specific physio scenarios that come up in almost every single interview. Let's start with part one. So risk is the biggest deal breaker with NHS interviews. The key sort of concept that you've got to remember is you're an autonomous practitioner and there's no doctor watching over you. And the NHS is also aware of this, the hiring manager is also aware of this, and they want to hire someone that knows when to treat, how to treat, but more importantly, when not to treat. Some of the questions can also be based on sort of heavy caseloads. So you could be asked on, given a scenario-based question on prioritizing patients and risk assessments. So they're assessing, once they've given you a heavy workload, how you prioritize and how you risk assess these patients to make sure you've reduced the risk of anything going wrong. So actually preparing for interviews is not easy, especially when you're nervous and you really want the role. But don't worry, I talk about this structure that you need to use so you can answer questions confidently in the NHS Job Fast Track Guide. It's a resource which is worth £49, but it's now free. It's got the tips and the tricks that I've used to help over 1,000 candidates in the job market. Click on the link in the pinned comment to get it today. So we've got another video on general interview success that we posted some time ago. It's a really good video. It's got, bits on body language, nerves, how to answer questions and how to prepare for any interview in the NHS. So if you've got some time, really do check it out. So the first framework that you need to be aware of is the NHS values and the trust values. So a lot of the NHS will now be recruiting on what we call values-based recruitment. So they're assessing your answers, not just against what the correct answer would be, but in terms of how well you reference the NHS values, which are care, compassion, competence, communication, courage, and commitment, along with the trust's own values. You can find the trust values on the individual trust websites, but there'll be something like kindness, improving, good patient care, communication. There'll be something sort of along these lines for different trusts, but they're marking you on these two things, how well you match your own values, you as a candidate, match the trust and the NHS values. And so for a lot of the questions, when you're answering them, you're going to have they're going to be having some sort of grading rubric. And for example, if they've asked you regarding a difficult patient, you need to give examples of how you're going to manage with this patient, with this difficult patient, but also mention things like, compassion, communication, so that you're sort of getting scored on the NHS and the trust values alongside sort of, the actual question, in terms of the scenario. The second framework is the STAR technique. So anytime they've asked you regarding sort of any situation in the past, or they've asked you a question like, tell us about a time you've worked in a multidisciplinary team, or tell us about a time you've worked with a challenging patient, you need to answer generally using the STAR technique. And that stands for situation, task, action, and result. So the situation is sort of, what's going on. So for example, if they've asked you about, working in a multidisciplinary team, give us an example and you can, lay the scenario for them. You can say that you're working on an orthopedic ward and there's a patient, where discharge has been delayed. And your task, that's what the T stands for, was to assess the safety, make sure the patient was safe to be discharged. And the actions that you took was, you made a joint assessment of the patient along with the occupational therapist and the social worker, because this was already a delayed discharge and you didn't want any sort of further fallback in the discharge time for this patient. And the result was that you discharged this patient safely back into the community with a really good care package. So this is something that the NHS is looking for. And a really good tip at this point actually is they generally will ask these questions on anything they've mentioned in the person specification and the essential criteria and the desirable criteria. So the STAR framework, anything that you've got in the essential and desirable criteria, make sure you've got examples that are for some more or less all of these criteria, and that'll make your life much easier, and it'll make you more prepared and more confident in your interviews. Quick pause before we continue. I want to show you a brand new tool I built that will seriously make your NHS job search faster, easier, and way less stressful. Let me show you how you can apply for an NHS job and prepare for the interview in under 60 seconds. First, I complete my profile so the tool understands exactly who I am. Now let's apply to an NHS job together. I search for a role, choose this one and copy the person specification and job description. I then paste this into the generator, and just like that, there it is. A fully tailored, personalized, role-specific supporting information section created automatically. Now I'm going to prep for the interview. I generate intelligent interview questions using the Smart Assistant, type in my answers and instantly receive feedback on how to improve them. After that, I revise using flashcards. I simply paste in the job description and the tool generates custom flashcards so I can start practicing straight away. Finally, I add the job to my tracker to keep everything organized. A process that normally takes hours, now done in minutes. If you want access, email info@healthhireuk.com to get started. So we've helped a lot of physiotherapists with their interviews, and some of the cases that keep coming up in most interviews are sort of these red flags, and we're going to go through all of these and just roughly talk about how we'd answer these questions. The first is regarding quad equina, which would obviously come up in an MSK section, and they'd ask you about a patient with lower back pain and how you're gonna screen them. And the answer is, you need to flag for, you need to check for the red flags immediately. So you're going to check for, bladder bowel dysfunction, any sidal anesthesia, any bilateral leg weakness. And obviously, if they're positive for any of these things, you're going to refer them to A&E, and hopefully they'd get an emergency MRI. And that's how you'd answer this question on quad equina. The second situation is, they'd ask you regarding a respiratory, a deteriorating patient. So they could ask you, that it's 2 a.m. in the morning and you've been called to a patient who's got dropping, O2 stats. How are you going to sort of deal with this? And the way you go about it is you're going to say, that you're going to do a structured assessment. So you're going to do an ABCD approach. You're going to check the notes, make sure, there's a ceiling of care, that, you're aware of what the patient's plan is. You've approached the patient, you've assessed properly. And if you're still concerned about the patient, you're then gonna escalate to the medical registrar. You're not trying to be a hero here. What they're looking for is someone who understands the situation, understands what their role is gonna follow sort of structured assessment routes, and then escalate to make sure everyone stays safe. And then the third question, so this can be a little bit of a difficult question because it's related to your scope of practice. So they're going to ask you, if a doctor is requesting something that you've not done in a long time, or you're not fully aware of how to do a certain technique and how you're going to go about this. And if something is outside of your scope of competence, the way you answer this is that you're going to politely decline and you're going to document this in the patient notes. And obviously you would seek supervision and teaching or training on this particular sort of technique. But because you're not familiar with this, in this situation, you would decline this request because patient safety does come first. They're not looking for you to just do everything and just be a yes man. They want you to make sure, like we said at the beginning, it's about risk, it's about safety, it's about staying safe and making sure we have the best outcome for patients. So don't be a hero. Try to make sure you're following sort of set scenarios, set protocols, and if you're not sort of happy doing something, you are aware of how to document this safely as well. So we've got a really cool feature on the Health Hire portal. It was one of the features that I really wanted to include when we developed the portal, and that is a Q&A generator. So the way it works is quite simple. All you do is say you've applied for a job, you copy the person specification and you copy the job description into the Health Hire portal, And the portal takes a minute or two, and what it will do is it will generate 25 to 30 questions on this job, specific to this job. They'll give you the questions and it'll give you the answers as well, and it'll be in a flashcard format. So what you can do is you can say whether you're confident with these questions and answers, you can say you're not confident, and then it'll keep bringing them up again. And you can also download this and then you can sort of print them out to go over them in your own time. So it's a really cool feature. It's helped me personally a lot in my own interviews, and I'm sure it'll be really useful for yourself in any jobs that you're applying for, any interviews. So do check it out on the Health Hire portal. So thank you so much for watching. If you liked the video, please give it a thumbs up and don't forget to claim your free guide. If you haven't subscribed to the channel, please consider doing so. Please leave any questions in the comments and I will try to get back to you. I'll see you in the next video. Bye bye. We built Health Hire to make NHS applications so much easier, from writing your supporting information tailored for each role to practicing real interview questions with feedback. It's all here. Grab lifetime access for just £70 and start applying with confidence. Email us at info@healthhireuk.com.